Hello everyone, warm greetings to you all. 29th October of every year is observed as World Stroke Day. The main motto of this is to spread the awareness of the stroke, because stroke is common and very serious brain disorder. It is preventable and also treatable if the patient is brought to the hospital early. So educating and making people know all about stroke is very important. Let us start with knowing what is stroke. Stroke is sudden loss of blood supply to the brain, part of the brain, and this happens because either there is a blockage in the blood pipe, this is called the ischemic stroke, or there is a rupture of the blood pipe. The result is same, the lack of blood supply to the brain. Either the blood pipe gets blocked or there is a rupture of the blood pipe causing bleeding in the brain. That's called brain hemorrhage. This is another type of stroke called hemorrhagic stroke. So there are two types of strokes. Ischemic stroke, which is more common, 80% of the time it's a ischemic stroke. There is a blockage of the brain, blockage of the blood pipe in the brain, and bleeding in the brain because of the rupture of the blood pipe. That is a hemorrhagic stroke. That is about 20%. Stroke is a common brain disorder. The prevalence is around 50 to 60 per thousand population. It means in India, 2 lakhs of people suffer from a stroke every year, and around 40,000 of people died because of stroke every year. To put it another way, every minute somebody develops a stroke in India, and every 4 minutes somebody dies of a stroke because of stroke. So stroke is such a huge disease burden and also a major public health issue. As I said earlier, stroke is a medical emergency. Let's see why. It's a serious brain disorder, and if not treated early, many patients die within 2 to 3 days. And almost 25% of the patients die within 4 weeks because of stroke. Another 25% of the people develop serious brain damage and become physically handicapped, permanent physical handicap they develop, and this leads to the dependence on the family members for even for a day-to-day routine activities like taking bath, eating, changing the clothes. For all these day-to-day activities, they become dependent on the family members. So the stroke is a big burden on the family and so on the society. So let us see why a person suffers from a stroke. What are the risk factors? Why the patient develops a stroke? The most common risk factors are uncontrolled blood pressure and uncontrolled diabetes. If you don't take your sugar and BP tablets regularly, it ends up with uncontrolled sugar and uncontrolled BP. That's a very high risk factor for the stroke development. Then similarly, high bad cholesterol. Then lack of physical activity, unhealthy food habits like eating junk food, excess of oil, especially the palm oil is very bad for health. And 3 white poisons we usually say, the excess salt, excess sugar, and maida, the flour, meal. By eating all these, the bad cholesterol increases in the blood, and that ultimately leads to the high blood pressure, diabetes, and the stroke. Then chronic stress, as you all know in today's life, the chronic stress and the type A personality is a basic denominator for all these issues which should be seriously tackled. Another point I want to stress here is the addictions, especially the tobacco chewing, smoking and tobacco chewing is very high risk factor, and similarly excess alcohol intake, also a risk factor for the development of stroke. Now let us see what are the symptoms of strokes. How to identify that a person has developed a stroke. The most common form of a stroke symptom is the paralysis of half of the body. There will be facial drooping, there is weakness of the arm and weakness of the leg. So the paralysis of the half of the body is the major, most common symptom of the stroke. But this is not only the only symptom. There are so many other symptoms. You should not get confused. If the person develops a difficulty in speaking or difficulty in understanding the speech and difficulty in it's called slurring of speech. So this can be a symptom of the stroke. And blurring of vision or double vision or sudden loss of vision can also be a symptom of stroke. Sudden development of imbalance. The patient cannot walk independently. He needs help from the other. That can be a symptom of stroke. Sudden severe headache with vomiting can be a symptom of stroke. So these are different forms of stroke symptoms. And abnormal behavior or a confusional state, the acute onset, sudden is a very important term. The sudden onset abnormal behavior, sudden onset of confusional state or irrelevant speaking can be a symptom of stroke. So to remember all these different symptoms, an acronym is made called BFAST, B-E-F-A-S-T, BFAST. B stands for loss of balance, B, balance, and E stands for I, loss of vision or blurring of vision or double vision. F is for the facial drooping, A is for the arm weakness, and S is for the speech and difficulty in speaking or slurring of speech, and T is to stress on the importance of the time. So once you know that a person has developed a stroke, let us see what are the tests are done to confirm the diagnosis of stroke. The commonest test done is the brain imaging. As I said earlier, there are two types of strokes, and the two types of strokes have a totally different treatment modalities. The ischemic stroke is treated differently and hemorrhagic stroke is treated differently. So to identify which person has which type of stroke, you need primarily a brain imaging. You can do either CT scanning or MRI scanning to differentiate them. And sometimes an angiogram is done. A brain angiogram is to know which artery is blocked and how much it is blocked. And all these patients need a basic blood test like hemoglobin and sugars, cholesterol, serum creatinine, and all these basic blood tests should be done in all these cases. Once you know that the patient has a stroke and you come to the hospital, let us see what are the treatment options are available. As I said, stroke is a medical emergency, and the first few hours of the strokes are very important, called golden hour of stroke treatment, golden hour. And once a stroke, why this golden hour is, once a stroke begins, the brain damage happens over a period of 4 to 6 hours. That stroke damage unfolds over 4 to 6 hours. And this is a time where the window of opportunity, as called as the window period, 4.5 hours is the window period for the treatment of stroke. This is because every minute 20 lakhs of neurons in the brain will be dying. So every minute is important. That's why called time is brain. The mainstay of treatment for this stroke, usually the ischemic stroke we call, 80% time it is ischemic stroke. The mainstay of treatment of ischemic stroke is thrombolysis. Here the clot busting medicine is given called injection TPA. This should be given within 4.5 hours so that the clot gets lysed, and it also prevents the further the clot formation, and patient will have a very good improvement. Once you identify, because strokes can happen in the house or in the office or in the road, anywhere the strokes can happen. Once you identify with the symptoms what I explained now, you should bring the patient immediately to the hospital, nearby stroke ready hospital. The stroke ready hospital means where the emergency services are available 24 hours, where there is the ICU, where there is the operation theatre. Stroke ready hospital, Sucharai, Keli Sucharai, HCG Sucharai hospital is one of the stroke ready hospital. Here we have already given more than 100 thrombolysis treatment to the 100 patients, and these patients have an excellent recovery. So this is thrombolysis is one type of treatment. Then some of the patients where we do endovascular procedures called mechanical thrombectomy. If the patient comes little later, for 6 to 8 hours, you can do a mechanical thrombectomy. You can mechanically retrieve the clot formed in the blood pipe. That its options available only to some of the few selected patients. So what are the other options of treatment? All these patients should receive, say after 24 hours, blood thinners called antiplatelets. You must have heard called aspirin or clopidogrel. All these patients should receive this treatment. And some of the patients we need anticoagulants, especially some patients who have heart problem, and if they have developed a paralysis, this stroke, they need anticoagulants. And we need another group of drugs called statins to reduce the cholesterol. Then control of blood pressure and diabetes is equally important, and other risk factors, and very important is lifestyle modifications. So these are the treatment options we know of. So my take home message for this stroke day is, stroke is a medical emergency, stroke is treatable, and so be watchful on the stroke symptoms and bring the patient to the hospital immediately for this thrombolysis treatment. Above all, which I want to stress is most important, is you can prevent the stroke by taking care of all these risk factors and the lifestyle modifications. So be watchful, stay healthy and stay happy. Thank you.